This conference will now be recorded.
There we are. Hydrostatic pressure. After the disturbances, I just continue with this, and this is from a really very good article by Pendergast, physiologist in comprehensive physiology, just a few years ago. You see, it's a very long review, and of course, the important topic in the reasoning why aquatic therapy could work in edema is what I showed here in the circle, and that is the hydrostatic compression of tissue, including the interstitial compartment, of course. Let's have a closer look at hydrostatic pressure, because logically hydrostatic pressure compresses. That's one of the four pillars there. And when you look at where I pointed the arrow, you see 25, and 25 is the pressure in this area, so in between the arterial and venous part, the interstitial fluid part, as you can see, in which also the lymphatic vessels are embedded. So that's about 25 millimeters mercury. And when you calculate 25 millimeters mercury to centimeters water, density of 13.6 of mercury, you come to about 34 centimeters, 35 centimeters of water. That means that every water pressure more than 35 centimeters under water surface would have an extra compression, and that means that there's a change of filtration and reabsorption characteristics. I think Suraj mute his microphone. Well,
power bank charge hai
looking at the literature, the articles about lymphedema and aquatic therapy, you can see these kinds of statements. And the hydrostatic pressure of water increases lymph and venous flow, and then protecting the lymph from swelling, and it reduces edema. But is it really true? Because already in 1987, in the American Journal of Physiology, Mickey and co-workers published this article about the thoracic duct lymph flow during water immersion. It was in dogs, but still the conclusion was that since lymph flow tended to decrease and not increase, the fluid shift in water immersion occurs across the capillary. That means finally the venous flow. So the previous slide talked about venous flow, that's okay, but lymph flow actually not. When we go back to Pendergast, to this article, you see this graph in which he said, well, because of the pressure, there are fluid changes in 4 compartments, intracellular, interstitial, and finally the renal department. But with the arrow here, you see the lymphatic flow actually doesn't really change. It also doesn't get less, as Mickey said in those dogs a long time ago, but it doesn't increase. There's no change. So let's go to compression arm sleeves or arm garments, as one of the topics also in breast cancer related lymphedema. And these are this is a classification of garments, including the pressurizing effect. And you see the pressurizing effect goes from 30 up to 60 and sometimes even more millimeter mercury, depending on the kind of edema. And for you, I calculated again the water depth in centimeters in relation to the millimeter mercury, and you see it's in between 27 and 28 the 34 centimeters we saw before. And that would mean that if water would have the same compression value as the garments that we use, that we should have a depth of at least 30 centimeters water, because that's about 20 centimeters or so, 27, 34. Well, remembering the movements of I Chi and knowing that normally I Chi is being done vertically with shoulders just on the water surface, and that means that arms mostly moving horizontally in the first about 15 centimeters, it is clear that the compression effect of water is just not enough in order to have the same compression effect as arm sleeves or arm garments. So that indeed an increase of lymph flow is more or less impossible. But then there is a change in flow. That's something that we all know from physiology. But once again, that goes over the venous system. So lymphatic fluids are filtered interstitial fluids. Interstitial fluids and lymphatic fluids actually are the same. There's some filtration, as you know. And interstitial fluids are the liquid components of the ECM, of the extracellular matrix, and that is an important part of fascia. Here you see a picture. You see fascia. The cells, the fibroblasts, mostly. And here you see the ECM in this area. And in ECM, you have the dry mass. There's mostly collagenous fibers and the ground substance with water that is either bound or bulk. And bulk water is a free-floating water. That's quite important in terms of hydration, rehydration, dehydration, as a basis for instance, nutrition and take away wastes, etc., etc. So tissue movement, I see I lost an M, is important to get flow, because there must be flow, and when the flow is not happening over the lymphatic system, then anyway it's happening over the venous system. So whatever system, there is movement, there is flow, and there is movement. And that movement can be through massage. And here I show the principles of training of fascia from one of the books of Robert Schleip, 2017, the second edition of Fascial Fitness, where he, with his background of rolfing, says, use the soft rolfing massage, for instance, but also soft movements, through active contractions are important for the four characteristics of a good resilience of connective tissue, of fascia, stretch, spring, and feel. But here I focused on revive, the regeneration of tissue through fluid exchange. Once again, smooth movements could be very important there, although on this specific topic in relation to water, there is no research yet. Well, when you look at then ICF, you see, this is a little part of the comprehensive ICF course set for breast cancer, where I just picked out some of the problems and treatment goals at the level of function and structure. You see, they talk about logically lymphatic vessels and lymph nodes, and exercise tolerance functions, another topic. Then you see mobility of joint and muscle power and muscle endurance, but they don't talk about fascia at all. And that could be, to our opinion, my opinion, quite important. Back to CDT, to complete decongestive therapy. Recommendations in the international guidelines there are basically always the same. And that is, first of all, the strength training and elongation exercises in the affected arm and shoulder and trunk part are important. And then starting with low training intensity, progressing slowly. But keywords, especially in the beginnings, are slow, smooth, controlled, and repetitive. And all these words fits very well in I Chi or clinical I Chi. So looking at I Chi, and this is a map, I call this conceptual map of aquatic activities that was presented by Johan Lambeck in his courses in Switzerland in the past and a little bit adapted by me. But basically saying, look, when you move, you can move with a high intensity. Yeah, that's on the y-axis on top, low intensity. And from left to right, you see slow and fast movement. So you have 4 quadrants, where a high intensity, slow movement is mostly focused to strengthening. You see cardio fitness, you see the open loop coordination, ballistic movements on the right side and down. And on the left side, relaxation, and I call this now the elements of facial resilience, that I just mentioned, where I Chi in the egg in the middle is quite important in this adaptation to this group. So a bit more about I Chi. Most people know it, and then you know that it is continuous and it's relatively slow. Slowliness is a nice word in this case, where movements should flow without force. That is good for the Chi. And you could call this effort in a relaxed way. And I took this from a Dutch colleague, Onno Meijer, who wrote a nice essay in Dutch in the link that I gave there. But where he, from his background of neuroimmunology, said this is quite important because it also affects low-grade systemic inflammation, and that is not so much a topic perhaps in breast cancer-related lymphedema, but now in COVID times it might be important as well. That's off the record, but it just pops up in my mind then. Well, movement and breathing belong together in I Chi. The repetition is important for the eye, for energy flow. And of course, this postural relaxation, also mechanics are important, alignment, and then you are careful. With movement, it shouldn't hurt. Some tension is okay. And the water temperature in which at the end of the session people are still comfortable. These are some statements and known thing in I Chi. Originated by Johan Lambeck. You see him together with myself, and on the back Urs Gamper in Switzerland 12, 13 years ago. Designed originally as a preparation for Watsu. That means first you do I Chi alone, then you do I Chi with somebody else, I Chi Ni, and then you go to Watsu, which he and his assistants presented in 1998, 1997 in the United States at one of the ATRI conferences, in which I also was, and where the general idea was, this is something that we can also do without going to Watsu as a standalone therapy, and meanwhile it has been established like this all over the world. Well, it's based on Zen Shiatsu, by Matsunaga, the man in black and white, who died already a long time ago. Always thought he was a medical doctor, but he was a psychologist when I Googled a bit. And he wrote a book about how to work with meridians, not in a classical way, with push, acupressure, or with a needle acupuncture, but by stretching. That is, it was Shiatsu. It was then made popular in the United States, and the word Zen came to it. So it is about stretching meridians originally, then integrating East and West, one could say, manual techniques, they say, from chiropractic, with the meridian knowledge from TCM, from traditional Chinese medicine, and by now there's more and more evidence that if you work with meridians, you also elongate facial structures. Yeah? So I gave a reference about fascia, which is the anatomical basis for meridians. So even if you don't know anything about meridians, there is a relation to fascia, which belongs more to the background of physiotherapy. To give you some ideas, 2 ideas. So the next slide was showing 2 elongations. One of the lungs, the lung meridian, which also actually is the ipsilateral functional line from anatomy trains, the fascia therapy that you might know. And the other one, about the urine bladder, which is actually a slump, and I will go in that a little bit more. So here you see Mayumi again, with the elongation, in which the lung meridian is then stretched. And although this is an adaptation of Aichi to Zensiatsu, because originally, in fact, it is like this. The blue drawing is from Masunaga's book. And the black and white is in Dutch. It says the meridians of the lungs and the long intestines are there. So originally there was a bit more elevation and more movement, so arms out of the water. And this is what you can also see in therapy of decongestive therapy. So these are some decongestive exercises in which, depending on the strength, on the range of motion, the pain, the tension, you ask for elevation, abduction, external rotation, as we also have in PNF, for instance. And this then led us a few years ago in Mexico, when we had another conference after the one in India, to the discussion with Paula Geigel, whom I mentioned, from Baltimore University, about adaptations then. And so you see on here demonstrating the applications of Aichi, in which also participants then in the pool lift their arm out of the water. Not completely according to the classical Aichi, but an adaptation to the decongestive therapy, where not only we elongate the lung meridian, but also if we stay in meridian philosophy, the triple warmer is said to have a connection with lymph. But okay. Well, Tida from Israel published a couple of articles on her aqualymphatic therapy. We even once met a long time ago during a course that I gave in Israel. And the big article was a PhD, and I will not go into the details now, but just a description. She uses gentle exercises with low resistance. The idea is to activate the proximal lymphotomes first, the healthy ones, with breathing exercises, and also massage, as they do in manual lymph drainage also. Then other topic is to start with proximal movements of chest and shoulder. And then when I skip 3, I go to 4, vertical positioning, but especially the distal joints. So the sequence of movement is from proximal to distal, as you can see in the guidelines of CDT. And if you remember the little video that I showed before of Mayumi, yeah, then actually the start is more from distal to proximal. And that means that you have to change the sequence of the movements, of the arm movements, of the arm katas of I Chi. Not only lifting the arm out of the water as you have seen before, but also the sequence. Yeah. And so I will show this. Yeah, this is the film that we made during our or after our online course for University of Toledo in Spain. Yeah, where arm is moving very slow. This video takes about 40 minutes. So also here I will have to cut yeah, because the part I would like to show, and there is a change from proximal to distal, yeah, it will be a bit more at the end then. I'd like to point out at this moment that she is talking, sorry, she is moving slowly. So let's jump a bit in the film. Yeah, various shoulder movements. Yeah, the sequence in which arms are going to elevation, external rotation, abduction is not in here. And I chose to show the proximal distal change. Then another jump. I have to jump. I didn't edit the film, but you hear something that I have to explain to you. The sound that you hear is a plane. It's a sound that we don't hear so much anymore. Otherwise, it's very quiet where we live, as you can see. So then you see from shoulder movements, she went to elbow movements. Hand or wrist movements. There might be questions about, is there any research already about this? And if so, I already can answer no. This is a proposal based on the decongestive therapy, based on what we know about fascia, in order to adapt the regular sequence to a sequence that is more pathology related. Okay. Yeah. Well, I mix a bit the practical things and the theory, the publications, but this is a nice one. And it's from an Australian group, although published in the Brazilian Journal of Physical Therapy not so long ago, where the title is, as you can see, if the speed of aquatic therapy exercises changes the effect on volume in breast cancer-related lymphedema. And it was done with I Chi. And the objective was to see if there was a difference. And where the author said, well, we use the I Chi movement with the regular velocity. And if you calculate, then the regular velocity in many cases is something between 30 and 45 degrees per second. And a regular aquatic therapy, which is faster. And they didn't describe, and that's why I contacted Deacon and asking her how fast is, well, twice as fast. So 60 to 90, but they say they didn't regulate this with any kind of pacing system. The results, well, the comparison showed that there was an advantage in terms of volume loss for those that made slow movements. So slow movements are important, obviously. And the point is it wasn't sustained, and that is something that you can see in other articles also. So the limb system functionally doesn't really increase, which is also logic in terms of what I explained before in physiology. The increase of flow cannot be accounted for by the limb system. There is an obstruction, so that goes over the venous system. But you see that 27% of the participants, they decrease their arm volume immediately after IG, whereas in the faster way of movement, it was only 28% there. There was no difference. That brings me to something else that will come up in one of the other slides also, but just already to mention, and that is that there are different ways to measure, of course. The classical way is to use volumetry. Then there are different ways, and the easy way is to put your arm in a bucket of water and then just see a difference in volume that you displace. And then you don't know what you measure. Yeah, you just measure a difference, which then means there is a difference in the amounts of fluids in your arms. When you measure bioimpedance, then you can be more specific, and in literature you see a difference there, and that is when volumetry says there is a decrease in volume. Bioimpedance can still say yes, but not in the interstitial fluids or not in the lymphatic system, which is according to the physiology. Also, good. I go to the next one, as I promised, and that is the urine bladder, and I will explain also why. Yeah, so this is the movement to increase the length of the urine bladder. That means in the drawing of the book of Masunaga, you see this, and for those that are familiar with manual therapy, they know this is a slump. Also, as you can see, the slump test there, and the adaptation by Mayumi in the water. Yeah, so the slump, or the variation, the finger floor test, is a very valid test, and measuring extensibility of the dorsal deep fascia, mostly collagenous fibers, of course, related to some other tests. Then, and various IG katas include elements of elongations from these tests. So the slump, the finger floor, are related, and I mention it here because Pablo Olabe, a colleague from Spain, did his PhD exactly on this topic. He is working in a thermal center in Spain, where they have the clients for 14 days. And the PhD was about comparing the regular program that they gave, every day all kinds of therapy, and compare this to also the program plus IG. That was in 2013. Daily for 12 days, the DDS, that's the Spanish of finger floor test, they showed larger changes in the group with IG. So IG, without going into the statistics, etc., it's not the place at this moment. But so IG has specific effect on fascia structures and function. And excuse me for one moment, then I close the door. There I am again. On fascia structure and or function. And so far, this is the only research that measured the elongation of fascia. It wasn't a big effect, and surely not about lengthening collagenous fibers, as you know. So most probably something happened in the ECM. So here you see the difference in the amount of centimeters in the finger floor tests between the control group and the intervention group. The intervention group on the right side was the group with IG before and after. And you see the difference from 18.80 in average to 70.3 in the people that have the regular therapy. It's about a centimeter and a half, one could say, as opposed to the intervention group, where you see a couple of centimeters more. And also the control group had activities in the water, but not specifically focused on the movements of IG, in which you elongate the lumbar parts. In summary, IG arm katas are normally performed water, of course, and can be integrated with exercises from decongestive therapy. It is low velocity, and that's important in this area, so that fit together. IG seems to influence extensibility of fascia in a specific way, referring to the previous two slides. In addition to the effects of immersion, there are effects of immersion, of course. There is pressure, probably more effects on the venous system, and that was shown by Pablo Olave for the dorsofascial chain. But then I guess there will also be effects on the ventral chain, the ipsilateral, or cross chains, as we have in the anatomy trains there. And it might also work on the fascia revive characteristics there. Well then, a bit more, if I still have time. They say that we should start with smooth movements that are controlled, low level of activity, but then gradually increase to the normal 60 to 70% for coordination of the 1 repetition maximum, according to the guidelines from 2019. But thinking about the ECM, the interstitial fluids that we want to mobilize, then probably low levels are better, according to Schleip. I mentioned the book already. About 30% of maximum force addresses probably the intramuscular fascia, the little filaments, better than the 60–70%, of which they say that this is more for the intermuscular coordination, intermuscular force transmission than for intramuscular force transmission. So maybe the slow movements in the research by Deacon, we're acting to this principle, more working on the intramuscular part. Well, movement speeds in IG are about 55 degrees or even less, as you saw in the video where Anshi moves very slowly. And then when I relate this to this research by Kelly from 2000, where they tested various muscles. Here you see 4, actually there were 6, compared land and water at various speeds, and not going through all these muscles, but just the one in the circle. You see the supraspinatus in land with 30 degrees per second, and had an activity of about 70%. In this case, was of the maximum voluntary contraction. That's what you meet with EMG, what you measure with EMG. And in water, about 4. In fascispinatus, 11 to about 2. And if you would go through the table at some moment, then you would see that at 30 degrees per second, at 45 degrees per second, the force that is necessary to move with these muscles and to contract these muscles in order to get movements, that they compared. In water is about 25% of that of land. So a very low resistance, which might be exactly the the reason why you see the small changes as Deacon described. This was in fact also nicely shown more recently by Lauer in Journal of Biomechanics. It's a very nice article, but not easy to understand. And as you can see, where he more or less replicated the research by Kelly, the 30, 45, 90 degrees per second research. He added a very low speed, 22.5. He said, it's 90 degrees with his model of inverse dynamics. That is just enough to reach the minimum of endurance level, as you can see. And in the, where is my pointer? There in the B, there. So slow Ig in this area of A and more to the left, indeed, seems to be more for fine tuning and not for muscular endurance, and certainly not for strength, which basically is the intra and especially extra muscular coordination. And that is then what they calculated also to say, well, if you want to move at the 70% of the maximum capacity, that's 70% of the one repetition maximum, then you have to have a speed of this arm. It was an arm movement, of course, that they made of about 175 degrees per second. So that's something that you will never reach with Ig. Good. A few more things. Then I hear voices. I don't know if it's for me. Anyway. Good. About effects on segmental properties of the arm. Looking at thoracic movements, then you will have mechanosensory input. Input coming here, in the dorsal root over there, giving information to all kinds of interneurons, and especially the lamina 7 is important because I hope you can see it's a bit small there. This has effects on the ANS, that's the autonomous nervous system. So that means that sensory information coming in will have an effect on especially the sympathetic system, because this is where the sympathetic system starts. You see the side string, the ramus communicans alba, and then go into blood vessels in muscles and innervation, the secondary neuron. Where, when I continue to the next one, especially here in the thoracic part, the high thoracic part, you see the effects on blood vessels and heart and neck and the trunk. And I couldn't find a picture in which we have also the innervation of the arms, but it will be somewhere in between. So all the rotatory effects that we have, that you have seen in especially the video by Mayumi, might also have an effect on the sympathetic system. The sympathetic system innervating smooth muscles in the arteriolae and metarteriolae, and in this way give a vasodilatation, and that might be then account for the changes in volume. Anyway, there is tissue liquid movement, and that is an important topic there. And so you can exaggerate thoracic movements. This is a picture. Don't have the video at this moment. You can imagine what she is doing. And the last topic is breathing. This is the program that was given to a community research research on community aquatic therapy to women with lymphedema, 2010, by Paula Geigel and a co-worker then. And the thing I want to point out here is that she said, as others do, always diaphragmatic respiration. And sometimes people say, well, you know, that's kind of automatic thing that we have. Indeed, it's important because abdominal diaphragmatic breathing helps to mobilize lymph, as you all know, but that does not automatically happen in water. When you look at the research on ventilation and the mechanics, so respiration, then actually we breathe less deep. That means less abdominal, more apical. And that means that you have to ask the clients on purpose to use abdominal respiration. And that is an important topic. And then for all the listeners in India, it's a part of yoga practice. And I saw already some years ago this wonderful publication on the physiology of breathing, prana, pranayama, which, when you don't know, can easily find where you see the importance of breathing on, for instance, the autonomous system. So that's another effect on the autonomous system, that is important, and in this case also helping to mobilize fluids in general. So deep breathing is important. Abdominal breathing, the same is important, but it doesn't happen automatically. You have to focus on this. Why water? The last slides. Then 2018, the review, finally a review. Colleague Young was a bit disappointed because there were not so many articles that he could include, in fact only 4. The conclusions, the evidence indicates no significant benefit of aqua lymphatic therapy. That is true because, in fact, always they found that the initial decrease of volume changed rapidly. After 1 hour, it changes, for instance, as also Deacon says. So further research is required, also because of the fact that there were enormous variations, as always. That's the problem of everybody who does a review. The researchers, they could only list the 4 studies that you will see. With not that many participants, all kinds of surgeries, the length of complications after the surgery, in between a few months and many years. And actually they say something that is also very important, that is that patient preference is an important topic to choose as a guiding element in choice making. And it was shown by the adherence rates there. Well then, relation I already show, kind of repetition, clinical IG relation with aquatic lymphatic therapy with decongestive therapy, despite the fact that the review wasn't that positive. It is a moderate aerobic program. Slow and rhythmic movements are important. You can include trunk rotations, breathing exercises, and then also change the direction. And quality of movement. Quality of life is important. So this is a very recent one, Ordinets in 2019. You see they looked at mastectomy and quality of life. They compared aquatic therapy, Pilates yoga, on land, the latter ones, The aquatic therapy was breathing, swimming, exercising, kind of mixed, not I Chi, but in all cases, the moderate effect sizes were present and all in favor of aquatic therapy, where quality of life changes had a better effect size in aquatic therapy than on land. And that fits with a model of positive health, in which on the left side you see daily functioning. You see the bodily functions on the top. And these are the classical parts of ICF, in which Huber and co-workers said quality of life is also important. So even when perhaps volume decrease is not the most prominent effect of aquatic therapy, of clinical I Chi, then other topics might help to add to the choice of preference. And that brings me to the end, in which if you would like to see a bit of I Chi, then on the one hand you are too late, so to say, because this is the flyer of the course that we would have given on the left side, the 11 days international certification course in aquatic therapy a month ago in Hyderabad, and on the right side in Mumbai in October 2020. That will always both will be next year. Different topics, but hopefully then interesting. And I would say have a look at, for instance, our website, or check out exactly when. The idea is in April and September next year, and hopefully then we don't have any kind of restrictions anymore. So in conclusion, we try to adapt the I Chi katas in such a way that there is a relationship with the decongestive therapy. We looked at the rationale of moving in water, the pressurizing effects, made a little hypothetical jump to the possibilities that we might have done work on some of the elements that are important in fascia therapy. And then the last point, we hope that colleagues will find these ideas usable. Try it out at some moment when we can be in the pool again, and publish experiences and of course share. And so also on behalf of Paula and especially Anne, I would say thank you very much.
Thank you, Johan, for this wonderful presentation on hygiene decongestive therapy. So I think all the participants were really motivated and really enjoyed this session, and they actually understood how slow, smooth control movement of I Chi help to reduce the lymphedema in a breast cancer patient. So we have a few questions here. So one person wants to know, in massage, mostly massage we go from a distal to proximal, and in I Chi you mentioned that we go from a proximal to distal to elongate the lung meridian. So which is the best one, and how it is like differentiated?
Yeah, the sound is not too good, but I repeat the question, and that is if you do massage, it also follows the same principle from proximal to distal? That was the question?
Okay. No. In massage, mostly in effleurage and all, we go from a distal to proximal. And in I Chi, it says we should go from a proximal to distal. So how is it is related, as in which is the best one? That's the question.
Yeah, but also in in DCT, you start with proximal lymphotomes in order to make space, proximal, for then the more distal manual massage techniques. So also there, the principle is the same. It's approximately.
Okay. Okay. And there is one more question about the triple warmer. So what is triple warmer?
I don't know.
think most of the people don't know here. Okay.
Yeah,
Okay. So here.
No, I will.
Okay.
Answer.
There are.
But I will answer.
Okay.
What I tried to say is that I Chi originally, in its philosophy and development, comes from how to work on meridians. And most of us don't know anything about meridians, and also me not so much. But when you look at the meridians they try to work on, so the ones in this case are related to the lungs, to lymph. Then you come to meridians like triple warmer and the lung meridian. And then the movements are about moving the shoulder in various ways. And then, of course, we say we do also something else, in that we move joints, we move muscles, and we move especially also fascia. So the relation with meridians and fascia that I wanted to make.
Okay. There's one more question about the contraindications for this therapy. In relation to breast cancer, are there any contraindications?
No, there is no contraindication for I Chi specifically in this therapy. If there is a contraindication, there is a contraindication for going into the pool. Yeah, so when there is no contraindication to go into the pool, like for instance enormous skin problems, then you can do I Chi.
Okay. There is. Can you share a few books on I Chi and aquatic therapy? That is the question has been asked. Books on I Chi.
Yeah.
Are there any?
Only one.
Or can you share a few?
Yeah, there's only one book of I Chi that was written many years ago by Yonkona Rutsova from the United States, the aquatic flow. I don't know exactly the title. And otherwise, yeah, there are videos and there are chapters in books. We wrote a couple of chapters ourselves in, for instance, Comprehensive Aquatic Therapy. Yeah, the book that was edited by Bruce Becker and Andrew Cole in the last edition, which is about 10 years ago, and then translations of this book in various languages like Spanish or Portuguese or even Chinese.
Okay. There is one more question. Where we can learn I Chi, or any videos are there specifically?
Yeah. The videos that I showed partly, can be found. But if you can still see my PowerPoint at the website www.itfinfo, where there is on the homepage there is an item about the course in Spain that we give, and there are the links to the videos that we uploaded to YouTube, and so otherwise there are some more, but you just have to Google. We're on YouTube. You have to search. But not specifically about breast cancer. This is an adaptation that we wanted to present, saying, look, I Chi in itself already works quite well. There is quite an amount of research, mostly about other topics then. And it might even be better working when you adapt this to the standard or the golden treatment that you have in a certain pathology, like in this case, breast cancer related edema.
Okay. And when is the ideal time to start I Chi session in pool post breast cancer?
Yeah, that always depends on the doctor. Yeah, that's
okay.
That's the practical answer. The same for orthopedics. It depends on the doctor there. But yeah, quickly Yeah, and when there is clearance, and the clearance is about is the skin is able to sustain the water, and especially the chlorine. So for this, good skin protection is important. When you can protect, you can go into the pool.
Okay. One of the person wants to know any precautions with IG sessions with COVID-19 patients.
That's another webinar, huh?
Yeah.
Now, once again, the how can I do this shortly? The advantage of IG is that in many cases you don't have to be with the patient, you don't have to touch, so you don't have to come within the social distance now that we have in many countries. That depends from 1 to 2 meters, by the way. Or you don't have to wear special protection in that case, like a face shield or like mask, etc. So there is distance. That's the good thing in many cases. And otherwise, of course, the question is if with COVID-19 patients, that means the ones that either have the virus, you should do any kind of therapy. I mean, that depends on the national guidelines that we also are updating at this moment. I mean, we are updating our position statement of IATF, in which we say always listen to your national guidelines. And in post-COVID patients, so that's the one that survived, especially ICU, and have all kinds of complications, IG might be of help, but we don't know. I mean, the so new, we don't know.
Okay, and there is one more question asking, can we use IG prophylactically for preventing lymphedema or as a treatment for a lymphedema that is already developed? Any recommendation or dosages for that?
Can we try to
use
find it?
IG.
I didn't see it. I don't see it. And so once again, if you can use IG for lymphedema, that
which is as a preventive measure or the treatment for the lymphedema that is already developed. So IG after the breast, okay.
Yeah. Look, when you look at this review, then actually the authors conclude we are a bit disappointed. Yeah, because the effects are temporarily not always better than on land, and so it depends on patient preference. I mean, this is not something that is worth shocking, because that's what you often see in reviews there. So that's a topic, patient preference. But then it is good to try to realize why then the effects of moving in water are not as good or as spectacular as we would like to hope. And so we gave some ideas, hypotheses, how this could be enhanced through variations in movements. In this case, we put the variations in IG. And if that really helps, if that really works better, it's something that we do not know at the moment. But if we don't start with an hypothesis, then we cannot continue with any kind of research.
Okay. How many times a week therapy needed to be done to be effective?
Yeah, there is something that actually indirectly already answered. The effectiveness is not so high. And then, in addition to what the reviewers say, I would like to go to the conclusions of TIDA, for instance, who found that there was this effect of repetitive therapy. But as soon as the intervention was over, as the research was over, and some of the participants, when I quote by heart, did not continue going to work in the pool anymore, and the lymphedema came back. So it is known that in general that it's very difficult to treat. So it's something of which the effectiveness is difficult to say in terms of months. Yeah, you have to continue with movement, but then probably lymphedema finally is something that needs a combination of treatment, like a garment or a sleeve, like manual lymph drainage, and when the goal for IG should be, for instance, to increase range of motion in the shoulder girdle, then, well, the therapy can stop when the range of motion in the shoulder girdle is good again. So it depends a bit on the goal there.
Okay. Then lastly, I just want to ask any take-home message for the therapists, like now they are not able to go to any pool to practice any of the aquatic therapy treatment. So can IG be performed on the ground and that can help in the breast cancer patient?
Yeah, probably also, but you missed the specific effects of
yeah, water, exactly.
Yeah, of water. But you see that in one of the applications that I showed on in a picture, yeah, you lift your hand out of the water also. But then what you do miss if you move underwater is the possibility to move at a very low force and also very slowly. And that might give the extra advantage, as we think now, on these tiny filaments that belong to the intramuscular fascial system.
Okay. Okay, thank you, Johan, for such a wonderful session, and it was really privileged to have you here in India. Everyone has enjoyed your session. Yeah, thank you very much. Thank you, IAPWC, for inviting me as well as a moderator for this session. We really appreciate the effort. Thank you.
I also would like to extend my sincere gratitude, IAPC and Johan. It was a very interesting talk to connect all the dots from different angles. It was very interesting to see how much amount of research is still required. It was really great. Thank you very much.
You're welcome. And I understood, Snehal, that it was all recorded and it will be on YouTube at some moment or etc. So people can still see.
Yes.
Yeah.
Yes.
Yes. Okay. Okay.
That's okay.
Nice to see you all. So I would like to thanks to Johan for giving him the wonderful talk, which is the newly topic, that is IG in complete decongestive therapy. Thanks to all the participants who joined from India and the abroad. Thanks to CG Prashantan sir and Dr. Deepthi Patil, who gave a precious time to join with us. No work is successful without my team. So I would like to thank our zonal head, Dr. Pooja Kamble, and also our the national head, the Ruchi Vashne madam, and Sanjeev Jha, our the president. Our Maharashtra state team, Dr. Suvarna Ganveer madam as a state coordinator. My whole team, sub-coordinator, Dr. Uttara Mohan, Nirali Sangvi, and Priya Karane. So stay healthy and stay fit. Thank you one and all. And please fill the feedback which is put in the chat box. Thank you all.
Okay.
Thank you, Johan.
Thank you.
Take care.
Goodbye. You take care also in India and whatever you are.
Bye.